Hi, welcome to the second part of this course. This is the part of the course that we're going to start to talk about thoracic mobility. What thoracic mobility is, how that relates to you, and actually what exercise are we going to do to maintain mobility, loosening, simultaneously strengthening our upper back. Let's first explore thoracic mobility. Thoracic mobility might as well be termed your upper back. For most of us, the anatomical names are not exactly relevant. So from here on out throughout the course, I'm going to use the references that I use when I speak to everyday individuals. Anatomy does not have to be a strong suit, nor should you have to pull out a book for this course. So let's talk about thoracic mobility. Thoracic mobility is essentially the upper quarter of your body, just on your back, your upper thoracic region. Now, our upper thoracic region is so important because that's where our shoulders sit. Our shoulders sit on our upper spine or our upper back. Well, how does our upper back become tight and diminish in mobility? Well, that's easy. If we look at our posture in a car, which a lot of times can be slumped over, at a computer, or even on the phone, this can really compound over time. If we think that we're in business for 10 or 15 years at a computer, and we know that we're always not mindful of our posture because we're trying to get things done. Now, is there one ultimate solution for your upper back stiffness or shoulder mobility issues? No. What we do need is you need to be empowered with the tools to be able to help yourself as your upper back tightens up, which it's bound to do. 99% of the clients that I see have tightness in their upper thoracic region, and this tightness in their upper thoracic region spills over into lower back pain, shoulder pain, jaw, head and neck issues. So we're just going to give you an exercise. I'm going to give you an exercise that you can use for the rest of your life to keep your thoracic spine, your upper back, mobile. Why is mobility so important? Well, the more mobile that your spine is, the more it can actually communicate from top to bottom. It can communicate something called cerebral spinal fluid, which allows for a smooth flow from top to bottom of your spine and its nourishment. You have synovial fluid, which is essentially like WD-40 for your joints. That happens as a result of your spine being movable, mobile. So this movement that we're going to go over today, we're going to be utilizing our pole and the movements that we're able to do in front of a TV. Why is it so great to work out in front of a TV? Well, nowadays, actually in 2014, there's some really good programming on. There's some really good shows that are quite informative. And if we are able to exercise in front of the TV, that means we're able to be so efficient with our time that we're able to feel good about ourselves because we were mobile. We're also feeling good because we're engaging in the programming we enjoy. And for most of us, we're also watching this with another person, which we get to enjoy their company. Now let's start to talk about the movement itself. Thoracic mobility. What are we going to be doing? We're going to be twisting, because so many times we lose our ability to twist as life goes on. Why? Well, that goes back to our posture in so many cases. How we're lifting objects in the wrong position, or we're on the phone, in the car, or at the computer. Our posture becomes fixed. And a fixed posture loses its agility and its ability to feed itself through movement. So we're going to engage our thoracic mobility. Our movement's going to be for our thoracic and upper back spine, twisting. So allow me to grab the pole, bring out the pole that we use in the first movement for our shoulder mobility. We still have the sticker on here. And what we're going to do is we're going to take the pole and we're going to put it on our upper back. We're not going to put it on our neck. We're going to put it just at the base of our neck, where we would say our neck meets our upper back area. If you want to, you can take the pole and stand in front of a mirror, and you'll notice how the pole does not exactly sit onto your shoulders. It's actually resting on my upper back, and here would be a side view. You can check yourself in front of a mirror. And then what we do after we feel comfortable about where the pole is actually resting, we're going to slide one arm over top and then the other. And what we do with our hands is we take them to the end so we can almost have control of the end of the pole as it rests on our upper back. Now our rib cage is open and our shoulder blades, the back part of our spine, are relaxed. Our arms are in a position where they don't have to hold themselves up so they're not burdened. We're in a nice, strong, athletic position. What does an athletic position mean? Well, I'm referring to our legs, specifically our knees being soft, and we can feel slight engagement or contraction of our lower leg muscles. And then from here, what we're going to do is we're going to work with our first movement. What do I mean? Well, I'm going to rotate as far as I can to the right. And as I do that, this is as far as I can go to the right until I start to feel it in my core midsection. Now I'm going to go as far to the right as I can, and I'm also going to rotate my head as far to the right as I can. And I'm going to pick an object with my eyes so I know how far that I go. Now I'm going to rotate all the way to my left, which will be to your right. I'm going to rotate as far as possible, again feeling this in my core. And I'm going to rotate my head as far as possible as well. And I'm going to pick an object there. The reason that we're using these objects is to make sure that we know how far that we go when we start. This way, after we're done completing the movement, we have a point of reference for how far that we traveled, and we can see a deliberate, definite, specific difference in our ability to rotate. So now let's move into the rotation portion for our thoracic mobility. I'm going to rotate as far as I can to the right, but now while performing the movement, I'm not going to rotate my head as far as I can. I'm just going to rotate my body as far to the right as I can and to the left. And I'm going to find a nice, smooth rhythm to rotate to the left and to the right. Now I'm not going as far as I can. I'm going as far as I can comfortably, just on the fringe of my comfort zone. And I'm also slightly squeezing down on my stomach muscles as I go to each side. So when I go to the right, I'm slightly bearing down to keeping myself from rotating as far as possible. So the object is not how far can I go. For thoracic mobility, it's how far can I go and engage my stomach muscles just at the end of the movement. So I'm rotating as far as I can, and I'll do anywhere from 6 to 10 movements each side. And then at the end, I'm going to rotate as far as I can to the right and look to the right. And now I'm going to rotate as far to the left as I can, and I'm going to look to the left. And I can definitely go further as I move to each side. And what does that mean? That means that literally, from those few seconds of twisting, my upper back is more mobile. So, as I take this pole off, this is why our upper back mobility drill with a pole is one of our key daily practice movements, because instantaneously your spine, your shoulders, and your neck can go further. And you can do this every day. I would like for you to do this every morning and every evening. The first week, you'll be doing it for 1 minute. The second week, you'll be doing it for 90 seconds. And the third week, and moving on for the next couple of weeks, up till we reach the 6-week mark, you'll be doing it for a total of 2 minutes. And that would be 1 minute in the morning, and again, 1 minute in the evening. The reason that that is so important is because then you're moving your spine every 12 hours. You're moving your spine every 12 hours for 30 days. Then you're moving it for 60 days, 90 days. 90 days, every 12 hours, you move your spine for 1 minute. That will be a much more fluid spine. You'll have a much looser upper thoracic area and upper back area, which will facilitate your shoulders, spinal health, head, neck, and lower back. And this is what I would like for you to do. So this again is our thoracic mobility, our upper back, and this exercise can easily be done in front of a TV. 99% of the people that I work with, this is a drill, an exercise, and a daily practice that they need in their life. It's so easy to do it. So please, join me for thoracic mobility, and I'll see you in the next section of our program. Thank you.